Thanks everybody for making some time for us today. Emma and I are here to talk about the Surrey Admiral Nurse Care Home project. I'm the Senior Commissioning Manager in the Older People's Commissioning team. And Emma, do you want to introduce yourself?
Yeah, hi everyone. I work for the business development team at Dementia UK. My role is regional development lead for the South East region, which covers any Admiral Nurse developments in Surrey and beyond in the South East.
And we would have also been joined by Hayley Harvey, who works as one of the Admiral nurses at the Royal Surrey Hospital, but unfortunately she had to attend some urgent business and wasn't able to make it today. But she is the kind of third party to this project currently. So we thought we would just talk through the project, what we're aiming to do with the project. I'm going to give a bit of context and explain where this has come from. And then Emma's going to talk through what an Admiral Nurse actually is and what the relationship is with Dementia UK, but also how this Admiral Nurse, or the two Admiral Nurses that we're recruiting for this project, will be acting slightly differently to how the normal service would operate. We're going to talk through some of the outcomes that we hope we'll achieve through this work and the key milestones, and then we'll talk about how care homes can get involved. We've only got 8 slides, so it's quite a short presentation. So if we go through all of that, and then we'll pause at the end for whatever questions people want to raise. And please feel free to put anything in the chat as we go, and I will review it when I have finished the presentation, if that's okay, and then we'll ask questions then. So, as Emma and I were just saying, we're really excited to finally be at a stage where we are recruiting to 2 Admiral nurses to support care home staff with people who have a more complex level of dementia need. The reason we have put this project in place, and I think this will be familiar to some of the care homes on the call who have worked with us in workshops and contract meetings to share some of their concerns and challenges, is the following context. So what we're hearing from the market is that it can be difficult to place, maintain or support placements where a person's dementia needs have become quite challenging and complex. Care homes are, we think, growing reluctant to accept clients that have a particularly high level of dementia need, and where there is behaviour that could be challenging or distressing, or potentially impacts on other residents living in the home, possibly behaviour that puts that individual at risk or others, and that's the feedback that we've had from the market. Care homes have also said that they don't always feel supported to take residents where there is a high level of dementia needs, despite some of the existing referral pathways. And certainly we already have an excellent Surrey and Borders care home team that is there to support care homes when they have individual residents and the behaviour of that resident might have changed. But it can be challenging to refer into that pathway. It's a small resource and it's not always readily available. But also care homes report wanting something that was a bit more available for their staff to kind of ask questions, to find out the best strategies or approaches in order to be able to support certain residents. Care homes in this context, when we had the workshop on this a while back now, also reported some difficulties in recruiting and retaining qualified nursing staff or staff that had a specialist level of training to work with this particular client group. And some providers even stated to us they just didn't feel equipped to support residents with a high level of dementia needs and behaviour that could be challenging or distressing. And we certainly heard of cases where care homes felt that they had accepted somebody, that person had moved in, and then they felt they weren't able to support that individual, and it was very difficult then to get them moved on to alternative accommodation. And they felt they were kind of left with an element of risk that they couldn't manage. So that's really the context for trying to look at how we could support the market in different ways. Twofold, really. Firstly, because obviously we want to ensure that all care homes that we work with feel they have the skills and the ability to look after a range of individual needs. but also because we're seeing the needs of the clients that we're referring into the market change. And we are seeing a growth in the number of people that have a more complex level of dementia need. And obviously, we need to be able to source placements within that market for those individuals. So I'll hand over to Emma, who will talk a little bit more about the Admiral Nurse service itself.
Thanks, Amy. It's worth just going through a bit more about what the relationship between Dementia UK and Admiral Nursing is in the first instance, because some people get confused by that distinction. So Dementia UK is the dementia specialist nursing charity, and we provide Admiral Nurse services within our organisation, which includes our Admiral Nurse helpline and also some other core clinical services such as Admiral Nurse clinics. However, the other arm of the charity within my role is to support with other organisations across the UK to employ their own Admiral nurses. And then the relationship between Dementia UK and that organisation is to, firstly, to help support with tailoring the Admiral Nurse service to the needs of that organisation and the locality, but equally also to support with the practice and professional development of the Admiral Nurse within the service. So we have kind of a development pathway for those Admiral Nurses. We have a dedicated online learning platform which has regular webinars and masterclasses. We have connection hubs for the Admiral Nurses to come together and to discuss cases. And so we really pride ourselves in upskilling those nurses in order for them to go out into the field and to support other health and social care professionals when they're employed in various services. And that does range from primary care to secondary care, naturally care homes, hospices, integrated care, and probably some that I've forgotten. But what's really important to note here is that with any Admiral Nurse, they are all registered nurses with specialist knowledge of dementia care. And Dementia UK are part of the recruitment process of these Admiral Nurses, so we ensure that they have an appropriate level of skill set and experience in dementia to be able to be in these roles. They can be registered general nurses or registered mental health nurses or learning disability nurses. It's just that kind of specialist knowledge of dementia care that is required. Typically, an Admiral Nurse service that is hosted within another organisation, so separate from those that we have as a charity, they have a kind of dual role. So bear with me because this is a slightly different and very exciting service, but typically the Admiral Nurse role would be dual, and the first aspect of that role would be provide expert support to families and their carers throughout the whole dementia pathway. So that includes pre-diagnosis all the way through to post-bereavement, again depending on the setting that they're sitting in. The second aspect of that role is to provide education, leadership and development to other health and social care professionals. And what's underpinning that work is that triadic working relationship where the Admiral Nurse is not just focusing firstly just on the person living with dementia, they're also taking into account the needs of the carer and the professional carer. And they also work with complexity. So that's very key to note as well. So as Amy said, she came to Dementia UK with these challenges within the sector that she'd identified. And so as an organisation, whenever someone does that, we tailor the service to that need. So in this case, we felt that actually, although the Admiral Nurse that we employ will have the experience of having worked with families with dementia and complexity on a regular basis beforehand, what we see as being the real innovative project for this particular area was to look at that education, leadership, supporting best practice of other health and social care professionals across the care homes. And I think what is really exciting about this is it's the first of its kind that where we're doing this. Admiral Nurses do naturally do this in their role, but they never have that kind of concentrated efforts and focus on that specific element as we see in this particular project. So that's going to be really exciting to see how that develops. And also, as Amy said, we'll have some key outputs to share with you on what we feel that could look like. But just to acknowledge that obviously with that additional focus, we are hoping to cover more care homes than we potentially would with just a traditional Admiral Nurse service. Thank you, Amy. If we could move on to the next slide.
Of course.
So alongside this, funding was another element to the focus of the role. So the approval for these Admiral nurses came directly from a workforce innovation fund. So naturally that had a slant on where the Admiral nurse is going to focus their attention. We are looking to employ 2 Band 7 Admiral nurses as part of the project. Admiral nurses can sit between a Band 6 and sometimes up to Band kind of 8A or 8B role, but in this case, a Band 7 is absolutely perfect. And we'll have 1 Admiral nurse sitting in the east, covering East Surrey, Surrey Downs, and 1 based in the kind of northwest area, covering Guildford, Waverley, and northwest Surrey, around Woking. Just to emphasise again, so they won't hold a physical caseload of families in this instance, and they will be focusing on the support of the care home staff. And they will look to cover, being a 2-year pilot, around 15 care homes in total. This could, change, but it's more about the Admiral nurse focusing on no more than, say, 5 homes on a rolling basis over these 2 years, seeing where the greatest need is. And, sometimes they might move on from one home, but potentially circle back if need be. It's all going to be up to, the Admiral nurses and Amy to determine that and how that works. The care homes that the Admiral nurse will work with will be determined based on a set criteria that I'm pretty sure, Amy, you might share in more detail, but I think there's some information on the next slide as well. Yeah, great. But the Admiral nurses will be hosted, as Amy, I think, mentioned, within Royal Surrey NHS Foundation Trust, but naturally they're working across so many different homes in these areas. And so really where they're being managed is within Surrey County Council. It's just the physical kind of line management structure in terms of, appraisals and things like that sit within Royal Surrey NHS Trust, which felt like the right place for them to be with the existing Admiral nurse there as well. And Amy, you might expand on that a little bit, but should we move to the criteria?
Yeah, let's go on to the criteria.
Great. So, I mean, there's a lot on this slide. I will roughly read through it, but I think what's really key as part of this criteria is that kind of initiative to and engagement with the service and being able to embrace the Admiral nurse. So I just want to say that I'm not sure if it's written in this section here, but the Admiral nurse can only work with care homes that really want to work with the Admiral nurse, or they'll see the best impact if they're embracing that Admiral nurse's intervention. So that's really key. But naturally, we do need to put there's a lot of care homes that we potentially could work with. So we set out some other criteria, which is being registered with CQC to either be providing dementia care already or have intention to register, having a safe garden area and access to stairs, and having a kind of dementia-friendly decor as part of the care home, having access to the right technology, access to the correct kind of beds that can lower to the floor, ability to carry out risk assessments and a clear management plan, signage for individual rooms, and consideration of access to a range of spaces which could help with activity, calm activity environments, and this must be more than one space. So that's in a nutshell, but as I said, that will be circulated in a lot more detail to you guys at a later date if you haven't had it already from Amy.
Yeah, absolutely. So I will be sending out after this. I'll send the slides and the expression of interest form, which I'll talk about in a minute, but I'll also send the criteria, which is really just supposed to help identify, from our perspective and yours, the ideal care homes to involve in this project. Shall we move on from this one?
Yeah.
Did you want me to, shall I talk through this, Emma? So I think ultimately what we really want to try and achieve with the project is a number of things, really. And obviously we would like to reduce the amount of time it takes us to place people who have a higher level of dementia-related need, a more complex dementia need. We also want to try and reduce the number of rejections. It's actually the number of rejections that tends to lead to the delay. So that's 2 key outcomes of the project. But we also want to see if we can report a positive change in the skills and the competencies of care home staff who are involved in the project. And there will be a baseline survey done with any care home that decides to be part of this. And then we will kind of do monthly check-ins with staff to see if there's a reported change against a set of criteria. We haven't agreed any of that, and that's definitely something that we'd be looking to develop with the Admiral Nurses in terms of how we manage that reporting. And I think we'd want to do that with the care homes involved in the project as well. But it would be good to see if there's a noticeable change in the staffing skills and competencies, as I said. And then also we want to make sure that any of the care homes that are involved in this work have some kind of legacy plan that will help them embed that learning indefinitely. It could be changes to policy where that's necessary, recruitment practice, it might be new initiatives that you bring into training and development plans. And again, I think the Admiral Nurses will be able to provide some real insight as to what would be beneficial to the market in this area, what sort of things they might want to consider as part of their ongoing learning and development plans. So lots of really great opportunities, I think, and potentially, you know, a real opportunity to work with people who have significant expertise in this field and who hopefully can work alongside staff to enhance the skills that I know are already there. So in terms of the milestones, just to give you an idea of what timescales we're working to. So we've set up the project, we've got the service collaboration agreement in place. Surrey County Council is kind of managing this project, but the roles are being recruited and line managed by Royal Surrey Hospital. They won't be based necessarily in Royal Surrey Hospital, though. As Emma said, they'll be working in the east and west of Surrey so that we have a spread across the whole of the county in terms of the homes that can be involved. We would like to have identified the care homes to take part in the project by the end of April. And I'll talk a bit more about how care homes can get involved after this slide. Optimistically hoping that the Admiral Nurses will be recruited and in place end of May. The advert's already gone out. We'll be interviewing those roles in April, so I'm optimistic that we'll have them recruited by the end of May. And then we'll be able to start the project, essentially carrying out a baseline skills audit for any of the care homes involved, and then starting the project with the identified homes, moving towards a final evaluation in March 2026 because it is a 2-year programme, and hoping that we might be able to build this into business as usual as something that we continue to fund for the market. The homes, you know, that are involved in this won't be working with the Admiral Nurses over a 2-year period, though. They're more likely to be working with them around sort of 6-7 months, depending on the nature of the home and the type of work that needs to be done. And that will also allow the Admiral Nurse to have a very small number of homes that they're working with, so that they can really dedicate their time to working with those staff quite closely. So finally, and then I'll take the recording off and we can have some questions. Care homes obviously will be part of this as a project. So this isn't a service that will be made available to all the care homes in the market. We need care homes to express an interest in working with the Admiral Nurses, and then they will become part of that project. And the nurse will then work closely with those identified homes to observe staff, to role model good practice and strategies, and to help look at how they can support clients with more complex needs. And they may also identify key areas for further development, and possibly out of that might be some learning and development opportunities for the wider market as well. Staffing levels are appropriate to needs, and the staff involved in this must have completed the carer certificate and some level of dementia awareness training. The council offers that training for free, and I have 2 sessions lined up, so we'll be able to get people involved in that if they haven't already been along to the dementia awareness training. There has to, as Emma said, there has to be a real commitment to meeting the Admiral nurses and working with them very closely up to a 6-month period. Obviously, the home has to be comfortable with the nurse coming in, working quite intensively with staff, being open to that kind of learning culture, not seeing it as a critique of what they're doing, but actually an opportunity to build on, the good work that the home is already doing. So what we're asking is for care homes to complete an expression of interest form, which I'll send out to the market after this workshop by the 7th of April. And then we'll be carrying out some visits just to see if that home is appropriate to work with us. And when I say appropriate, I guess we just need to check that yes, the commitment's there. I'm sure that won't be an issue, but also is the environment conducive to this level of need? Because some care homes might struggle to support somebody just based on the environment alone, let alone regardless of how great their staffing is. So that's kind of where we're at the moment. If I stop the recording there, and then we can take some questions.